Hi, and welcome back to your show. This is the View of all of you, and where we share tons of information, updates, provide information directly from you, take questions and feedback from you, and we address them here to keep all of us accountable to you all. Today, I'm joined by two guests, and I'm going to have them introduce themselves to my right.
Hi, I'm Allison Pangilinan. I'm the patient safety nurse here at All of You.
Welcome.
Thank you.
Yeah, you nervous still or no?
A little bit.
Only 1,000 people watching. No, she's going to do great. And to my left.
Jackie Spiegel, I'm the patient safety officer.
So they're going to tell us a little bit more about patient safety work that they do and why is it important to our medical center and how you can help out in our patient safety efforts. But before we get there, we're going to mention a couple of announcements. So this month is National Volunteer Month. And so we honor the incredible contributions from our volunteers and the difference that they make every day with our patients. You know, they kind of, I don't know if you've seen them, I think it's on the first floor that they just sit there and wait, right, with the wheelchair. And they're at the ready to help our patients. And they dedicate a lot of their time to help our patients, to help us out and help with our patient navigation and movements so they can get to their appointments on time. So thank you for all the time and energy in support of our mission here. And we will be hosting a volunteer dinner on Friday, April 25th to celebrate and honor them as they truly deserve. We couldn't do it without them, so we thank you for your unwavering support. I haven't seen a menu for that Friday, so I hope it's something good for them. So it's also Laboratory Professional Week. So a huge shout out to our incredible lab staff as we celebrate Laboratory Professionals Week, and that's from April 20th through the 26th. They provide an important work for our patients and our medical teams and our to be able to care for them. And I'm talking about, and there's tons of folks that work in lab services and lab assistants, phlebotomists, tissue analysts, all types of technicians, cytotechnicians, pathology and the clerical staff that really help out in these operations. So I want to thank you for all your work, and they operate a 24/7 operation. So thank you for your tireless efforts and commitment to excellence in patient care. So if you see them around, then they usually walk around with those white disposable lab coats. If you see them around, just shout them out and say Happy Laboratory Services Week. All right. Also, we're still in Earth Month, and as a reminder, we continue to have a lot of activities in support of Earth Day. Number one, we received many donations, so thank you for your contributions. Continue to donate. We need new clothes, toys, supplies for maternal child department. Feel free to drop them off in admin in 2C 155. Lightly used clothing, please drop that off. We have the drop-off pins located on the first and second floor lobbies, so look out for them next to the popcorn vending. You know, they have popcorn vending, right? Have you bought the popcorn?
I have. It's pretty good.
It is pretty good. I consider myself a popcorn connoisseur, and it's pretty good popcorn here. But the drop-off bins are in the first and second floors. Go ahead and drop off those donations there. Also in support of Earth Day is Meatless Monday menu at the Olive Branch Cafe. I like to eat meat, and I know it's not great to eat tons of meat in support because beef, emits a lot of CO2 gas, and it's not good for our health, but the planet. But I did try the spicy carrot Buddha bowl, and it was interesting. So if you're into, Meatless Mondays, they have an awesome menu on 2 days. The next day is on April the 21st, where they have the Cauli Club. Oh, I guess it's a play on cauliflower.
Yeah, I think so too.
Cauli. So, like, for example, the first menu item is going back to Cauli bowl. I think that's, what's that rapper's name? I'm going back to Cali. It's a play on that song, I'm sure. Anyway, yeah, on the 28th, they also have another menu. And you said that the oyster mushroom rice bowl sounds interesting.
It does.
Yeah, so it's like a mushroom risotto, maybe. Who knows? But try it out. It's in support of Earth Week. Go meatless. Go meatless on Monday. I will go meatless. I will make the pledge to go meatless on Monday, and maybe cut out some less meat in my diet. Also, spring cleanup. The week of April 21st to the 25th. If you have any supplies, furniture, equipment that you do not need, go ahead and remove that from your department. Fill out this form that you will find in a link somewhere around here. They might display the link somewhere around here, but there's a form that you fill out so folks can come and pick that up. This is something that you should be doing anyway. We are in the window for GAC survey, which you guys, I'm sure, have been doing a lot of work on as well. And, we always should be survey ready. And not so much because we want to be survey ready, but it's just the right thing to do for quality care and patient safety. So make sure you clean up your departments and check out our broadcast because we're going to have additional information there as well. All right. And there's going to be a special meal for Stop Food Waste Day on Wednesday, April 30th. They will showcase the wonderful work that they are doing in the kitchen to minimize waste. There's actually, did you guys know there's an actual statute, a state legislation that says that hospitals will not waste food and they will recycle food waste. So they can go and in support of that to reduce waste and reuse the waste that we do produce. So Chef Nick will prepare a meal using recipes that minimize waste using ingredients in their entirety. That sounds interesting. All right. And so, a lot of what we talked about touches over a lot of the work that you all do in terms of patient safety. So I'd like to start with you, Dr. Spiegel. Tell us a little bit about your role. What does it mean? It's an obvious question, right? Like, why is patient safety important? Well, to keep patients safe, but there's a lot more that goes into that. So why don't you tell us a little bit about your role?
Yeah, absolutely. So it is to keep patients safe, but a lot of that is beyond the direct patient care that we do. So we also assess, prepare patient safety initiatives in our hospital. A lot of it revolves around compliance with national patient safety goals, and there are community-facing measures like Leapfrog or CMS star ratings, which anyone can Google. And so we act as a liaison to facility, departmental leadership, and in doing that, we review lots of cases that could be potentially problematic. We revise policies and just look at our practices with quality and risk and make sure that our patients and our staff are getting safe care. And Allison and I do that really closely together.
We do.
So you work with Dr. Spiegel?
We do, yes. Or I do, I'm sorry. And we do really work closely with the quality team. So a big shout out to the quality team and Dr. Cody and the rest of them. They do a great job. So as my role as a patient safety nurse, my job is to ensure patient safety and their well-being. And I collaborate with Dr. Spiegel to identify, report, and analyze any safety concerns, develop protocols, and work with other healthcare professionals to minimize risk. And additionally, I also educate staff on safety practices and support quality improvement initiatives to enhance care and reduce adverse events.
So the work that you all do is not only to, if there's a patient safety event, you analyze it, you address it, but you also do proactive identifications. Yes. Tell us why that's important.
It's really important to be proactive because we want to listen to our healthcare providers, not just listening to our doctors and our nurses, even the nurse assistants. It's really important to get their feedback because they're the ones that are really on the floor with our patients and providing that care for them.
Tell us about harm reduction and why that's important.
Yeah, we want to make sure that we're approaching things before they happen. And so we really rely on all of you to let us know what's going on and things that you all see on the front lines as potential causes of harm. whether that be directly impacting patients, like things that increase fall risk or, adverse medication events, or things that are just part of the structure of our hospital that may be harmful to patients in their day-to-day activities.
And when we talk about harm, it's not just physical harm, right? It's also harm in the form of preventing infections, preventing readmissions. Tell us a little bit more about that work.
Yeah, so through the SI system, we've learned a lot about the types of harm that can come to our patients and our staff. And a lot of it is revolving around communication. And poor communication leads to interpersonal issues, errors with our patients. And then in the end, it does cause them to come back because they didn't understand their medications or what the plan was for discharge or whatever it is. So we really look at the whole process, start to finish.
All right. And it's just the two of you, but it takes a team. Right?
It does take a team.
Well, why do you feel your roles are important?
Some of this is promotion of everyone contributing to this safety team. We feel that everyone who works in this hospital and everyone who comes into this hospital contributes to the safety of our patients and our staff. So we consider everyone part of our team. We work, like Allison said, very closely with risk and with quality, but those all reflect the work that everyone else is doing.
Sure.
One of the most important things that I know that maybe most of our viewers or staff don't realize is why we talk about hand hygiene so much. I think when I first got here, I think people thought I was a little neurotic because every time I walk in, the first thing I do is wash my hands. I've been told that, tons of times. Yeah. But why is hand hygiene so important?
Well, first off, it is the single most important measure to prevent the spread of infection. And it's also part of our national patient safety goals. That is the Joint Commission's part of their list. So that's a really big thing for us. But, it's really to protect not only our patients, but ourselves too, when we're providing that care for them. And so we do have the resources here at our hospital where we can be more compliant. I just did the numbers for Q1 for this year. We are currently at 80%, which is good, but our goal is to be at 90%. 100 is great, so we can all be compliant. But every month I'll be sending this data to all of our hospital leadership so that they can send that data to their units and to share it with all of the staff. And also, we are always looking for hand hygiene champions. So what these hand hygiene champions do is they go into our inpatient areas and the ED units, and we're doing observations on all of our staff. It's not just MDs or the nurses, it's lab, it's housekeeping, it's the x-ray techs. We're looking at everyone and just making sure that they're doing their part in keeping our patients safe. And really, our hand hygiene champions are there to serve as a reminder to everyone that hand hygiene is important. And it's really the best and the most simplest way to, for all of us who work at all of you, to contribute to patient safety.
Yeah, I mean, I'm sure you've been at a restaurant and, a guy wearing, the entire white suit is the chef, comes in, uses the restroom. You don't hear you don't hear the sink go on.
I've had those encounters before.
So we wouldn't want our chefs to do that in the places we're eating. And so we shouldn't be doing that in one of the, cleanest places that we should be working in is our hospital. And so, hand hygiene is super important. Even my kids, I remember one time my son is like, we went camping and he was like flipping out because he couldn't wash his hands after using the restroom. I go, it's okay, you're going to be fine. Just use this gel, but he wanted water and soap because it was my fault. You got to use hard soap. That's the only way to remove it. But no, and that's why we have a lot of what are these foam dispensers?
Yes.
Located sanitizers are across the facility. So wash your hands, use hand hygiene. People are watching. That includes you volunteers as well. But we also started something. I hear that your department started patient safety rounds. Tell us a little bit more about that.
We did. We're really excited about patient safety rounds. We started last month, and we're going to be doing patient safety rounds on different areas of the inpatient and outpatient areas. around twice a month. And so we're going to be going unit to unit to promote the SI system, to really show people that we pay attention to these SIs and the utility of them and how to do them. And figure out what's going well and what's not going well on each unit. We're going to be looking for trends and figuring out what types of projects we need to undertake. But this is where we can have you meet us and us meet you and really get your questions answered and show that we're paying attention and that everyone contributes to safety, both for our patients and for our culture at this hospital.
Yeah, and an SI is the safety intelligence system where you can report incidents or potential incidents or things that you feel we need to fix or address. This is very important feedback. It helps you, it informs your work, it informs where these hotspots could be, these potentials. So if you have suggestions on how we can improve, or if there's something that you noticed that you want to make sure that Allison and Dr. Spiegel are aware, submit that through the SI. It's valuable information, and like they said, it helps us keep proactive and analyze any incidents so that we can prevent them in the future or minimize the risk. So Dr. Spiegel, Allison, thank you so much for your work. I know it's not easy, but we appreciate the work, and they're going to stick around and help me with the rest.
Yes.
All right. And so last 2 episodes ago, I think we started Trivia of the Week. And the first was won by, the first trivia question was answered by Hannah. And Hannah, if you're watching, and I know you watch, you haven't picked up your gift card. There is an expiration date to your gift card. So if you don't come and pick it up, we're going to offer it to the next person. So come by and pick up your gift card. So congratulations. The answer to the last trivia question, that was 2 weeks ago. And the question was, what was the original purpose of Olive View when it opened on October 27th, 1920? Allison, do you know it?
I think it was to treat TB patients.
Yeah, that's right. She just read it off the screen. No, she knew it. She knew it. Yeah, it was to treat tuberculosis patients. And in fact, a lot of the cottages that you see there are still the same buildings that were in existence in the 1920s. So the winner of the CEO's gift card for this week is Arash Nafisi. So that person answered on April 2nd at 1:58. They were the first person with the correct answer. Come by to administration and pick up your gift card. Congratulations. And we're going to have another trivia question. You want to read it off, Allison?
Sure. In 1962, Olive View Hospital in the San Fernando Valley became one of the first in Southern California to perform what groundbreaking medical procedure?
And this is news to me. I see the answer there, but I'm not going to announce it. So the first person to answer in the feedback button wins one of my gift cards. So please do that. But I'm pretty surprised with the answer.
No, I didn't know that one either.
I didn't know that. All right, so thank you. On to shout outs. We want to shout out Dr. Norman and Dr. Shaheen, and this is coming from a medical caseworker. Huge thank you to them for going above and beyond to ensure a smooth discharge. Appreciation for providing excellent leadership, and they exemplify going the extra mile. Thank you. Also from Alicia Barajas. Allison, you want to help me with that?
Sure. This is for Adam with Office Services. While walking to Office Services, I saw Adam in the hallway with a patient who was visibly upset. Adam remained calm, friendly, and professional, taking the time to listen to the patient's concerns. He acknowledged their frustration, offered an apology, and reassured them. As a result, the patient felt heard and calmed down, and the situation did not escalate. It was a reminder that sometimes simply listening can make all the difference.
Absolutely. Thank you so much, Adam. We should all be a little bit more like Adam, so thank you. And from another medical caseworker, we want to shout out Team B.
So a big thank you to the Team B interns for their hard work in managing a challenging patient. Your dedication helped ensure a successful discharge.
Awesome. Thank you so much. And also from Ann Soto, who would like to spotlight all the hardworking women in the ICU. And this is for Women's Month, I believe. And so thank you to all the women, hardworking women in the ICU and at all of you. Also, they want to do some on-the-spot recognition. This is for Luis on the second floor information desk. And this came from a patient. These are so valuable when they come from patients. Yeah. Luis is very polite and kind. He was helpful and very willing to assist me with all my needs. Thank you, Luis, for as an example of what all of you is and here for our patients. Thank you so much. Also for Mary Obando, from also another patient. Mary's attentiveness and expertise not only made my experience smoother, but also instilled a sense of trust and confidence in my treatment. Her dedication and kindness truly makes a difference. I felt like I was in great hands. Awesome, great work, Mary Obando. Thank you so much. And a few shout outs for Armenian American Heritage Month. We have several staff nominations. If you still believe that there's someone that you want to nominate, hit that feedback button and let us know. The first recognition is to Gohar. Gohar is an RN working in SDU for 25 years. How long have you been working here, Allison?
It'll be 19 years in September.
Gosh.
Wow.
Yeah, you're close to 25.
Yes.
Yeah. Here at all of you?
Yes, at all of you. Yeah.
How about you, Dr. Spiegel?
10 years in DHS and 2 at all of you.
I've been here for 6 months. Gohar is a dedicated mother, grandmother, and county employee. She's skilled, provides excellent care. She's a thoughtful host. She organizes dinners and lunches. She's known by Mama G, or Gohar Jan. And so we're proud to have her on the team. Thank you, Gohar, for your 25 years of dedication. And the next one is for Barduhi from social work. They admire and respect Barduhi. She started at all of you years ago. It doesn't say how many years, but years ago. And she's known to be polite, kind, and thoughtful. And she often brings in delicious Armenian food to share at our potluck parties. I'm a little upset because I didn't get an invite to that.
I know, we have a lot of potlucks to go to.
Yeah. I love to eat. As long as it's not meatless, we got to go meatless. It's important. And also the 6A nurse educator, Anna Shea. She just doesn't teach. She also empowers our nurses with knowledge and skills and confidence. She's a key in ensuring the smooth transition. She also has made people feel welcome and prepare for the future. Thank you, Anna Shea, for your unwavering support and dedication, and happy Armenian History Month. So thank you, Anna Shea, for all the work that you do in 6A. And as you know, we visited your department, we haven't, or maybe we haven't yet, but we will. The executive team goes around visiting different departments and just having a conversation. We visited food and nutrition department. So it was my first time actually being in the actual kitchen. Have you been in the kitchen?
I actually have, yes.
You have?
Yeah.
All right, how about you?
I have.
Yeah, cool.
It's enormous.
It's big.
Yeah, that's my first reaction when I've been to countless kitchens in different departments because I like to eat in different hospitals. And yeah, they have a huge kitchen. But one thing that I noticed that was above any other kitchen that I've been to is it was really clean and organized. And that says a lot because a lot of these kitchens that I've been in are not very clean and organized, but ours is very clean and organized. And I even checked the ice machine where sometimes they forget to clean and lifted the lid and I checked and it was clean. So huge shout out to that staff. You guys do incredible work. We talked to them. They not only provide food. Why is nutrition important in the recovery and the of a patient and the well-being of a patient?
So many reasons. Well, for me, food is love. So if you're feeling well enough to eat, that means you're on the road to recovery.
Yeah, absolutely. So the care that the work that they provide to our patients is amazing. We talked to folks like Martha, who's been here for 37 years. That's a long time. And she said she loves working here and understanding that she has helped someone. She has made a difference in someone's life here. And so it's right. The food that they produce does go into the help our patients heal. And food is love. They make them feel better with that comfort food. So thank you. They had some great suggestions that our administrative team is looking into and working on. There was a few shout outs to Sergio, which is the director of that department. Shout out to Luis. Luis always has a huge smile. So thank you for all the work that food and nutrition. Do you have like a favorite, item that they sell in their kitchen?
Oh gosh. Well, on one of your shows, someone did talk about the burritos. I can attest to that.
Really?
Love them. They're the best. And I also really like their kettle chips. Those are pretty good too.
So they make their own keto chips?
I believe so. I'm not sure, but they sell out. So
All right. So yeah, keto chips and burritos approved by Allison. So check them out. I keep hearing about burrito. I haven't tried it. I gotta do it.
yeah,
So
you got to do it.
I gotta try it. So, as long as it's meatless, right? Just meat Earth Day.
Just on Mondays.
Yeah, just on Monday. That's good. All right, so on to your questions. We received tons of feedback. I appreciate all the feedback. It's actually helped. I'm going to provide a couple of updates on some of the feedback that I received in past episodes. Number one, they wanted to have the screensaver, the kitchen's menu more accessible. We heard your feedback, and the incredible people behind the scenes here have been working on that. And so you can access the Food and Nutrition Department on the landing page. Click on the Olive Branch Cafe logo. That'll take you to their homepage where you can click on the menu, and it'll show you what the menu is there. Food is love. And so I'm going to remember that now. So food is love. So food is love. So I know how important it is, and we made that change for you all, so it's easier to get to. Another suggestion, can the pharmacists that are entering the medications on the MAR, which is the Medication Administration Record, the MAR, please enter it in an hour versus random minutes. Yes, we do that already. We reached out to the pharmacy team, and most orders are rounded up to the nearest hour interval. It's only those, the one-time PRN orders that will have that time. All right. Is there any way you can add 2 more registers at the cafeteria so the payment process is faster? Sometimes it takes a long time. Absolutely. The cash register line, they recognize, we talked to the food and nutrition team, and they do recognize that it does take a little longer, but it was part of the problem with this register system. They have since resolved that issue, so you shouldn't see those long lines. They're actually pretty good, but we have to be understanding, right? Like everybody goes from 11:30 to 12.
Yeah.
It's a huge rush, and they're doing their best. I also understand some of us only have 30 minutes to get to lunch, but they did add a 3rd register that I've seen a little past week, so it's going a little faster. So thank you for that feedback. More feedback. I like the new look of the All of You icon, but it doesn't identify it as it's the CEO's YouTube episodes for staff. I mean, that's great feedback, right? So we will be adjusting. Again, the fine people behind the scenes are working on that to adjust it so that it's the CEO's YouTube channel. Or like the ring. Food is love. Food is love. I really love the episodes of The View at All of You. It is a great communication tool. Thank you, Leslie. Appreciate that feedback. If you have anything you want to hear, you want to see here, we had a lot of feedback. For example, they asked us, how come we don't see nurses? We've been seeing a lot of physicians, so we brought Allison, we brought Kim on a few other episodes. So yeah, we actually take your feedback to heart. And at All of You, everywhere I go, employees are sharing their fears of layoffs, promotions, being put on hold, job freezes, and rumors of no money for raises. Can we address this? Yeah, we actually dedicated a few minutes to talking about this in the last episode, and I totally understand. This is something that we're trying to prepare for. As we talked about in the last episode, we're preparing for these potential Medicare and Medicaid cuts that are possibly going to be made. We were expecting those to happen last month, but they were extended into September. We don't know where this is going to be, or where this is going to go, what's going to be what's going to end up being cut, and how much of it, and how that's going to affect us. However, I do recommend that you also click on Dr. Galley and Alan Wecker, which is a facility CFO, do an awesome job of breaking down how these potential cuts could affect us and what we're doing to make sure that we're in the best position to avoid any of these rumors or fears of layoffs and all that. So I suggest you click on her town hall. They provide great information for that there. All right, some more feedback. I'm excited for the Armenian specials in the cafe. I've been an employee here for over 25 years, and the food is always fantastic and such a great deal. There we go again. with hot
Burritos.
coffee and breakfast burrito makes my morning all that better. I just gotta do
You
it.
gotta go.
Why don't I actually film that? What do you guys think? Bobkin,
Oh,
can we do that? My first time trying the breakfast burrito, I think it would be a great video, and maybe we can display
make
it.
sure you get the salsa too.
All right, the salsa. All right. Awesome. So we'll do that. All right. Can we get another feedback, more feedback? Can we get the CEO and all the chiefs, directors, department heads, and all level supervisors to commit to volunteering at least once at the bi-monthly Olive View Community Patient Produce Distribution, first and third Wednesday of each month from 8:30 to 11? Can the CEO volunteer? Can he promote the volunteer opportunity in the next YouTube episode? Absolutely. I just did that. I think it's super important. I will commit myself to volunteering at the next CEO. So if you want to see me, I'll be there helping out. I was told I need to wear comfortable shoes. So that gives me an excuse to wear some comfortable shoes that day. But it's a great event that's put on by a lot of our folks. Brenda, who's behind the scenes here, assisted in that, and also Grace Keller. She's great in helping that. And we do see a long line, so there's a need. And so I'll talk to our administrative staff, and maybe Allison can volunteer one day.
Maybe one day.
Maybe Dr. Spiegel, all right.
Absolutely.
But yeah, I'll be there. And yeah, if you guys want to volunteer, please reach out to us and let us know, and we'll let you know what the opportunities are. And so we learned a lot today. We learned a lot about patient safety. We learned that you've been here for
Almost 20. Well, 19 years this year.
Let's round it up.
Let's round it up to 20.
And we learned that food is love. And so what's that soccer show that they say soccer is love? Or Ted Lasso. And they say soccer. At Olive View, we say food is love. So Dr. Spiegel coined that term, that saying. So I want to thank you all for the work that you do every day. Your work does make a difference to a patient's life, even if you're working in patient safety, if you're working behind the scenes in IT. All this makes a difference in someone's life. So thank you for the work that you do. Don't lose sight of that. Care into action. Make sure that we are kind to each other, that we support each other. We're here for the same reasons. The mission to deliver excellent, high quality, safe care to our patients. So thank you for all you do. Tell your coworkers, tell your friends about our YouTube channel. This is great information to highlight the great work that we do, highlight work that Allison and Dr. Spiegel does to ensure that our patients are safe and that our staff are safe. And I am required to say, smash the bell, drop a like, hit that subscribe button. Please stay safe. Help each other, be kind to each other, and we will see you in 2 weeks, and I will have the burrito review by then.
All right.
Thank you, guys.
Thanks.